The following is presented by United Way of Northeast Florida, proudly supporting mental health services in our community.
For a long time, mental health was something that just wasn't talked about. And when it was usually in the context of mental illness, such as schizophrenia, bipolar disorder, or depression. But mental health is actually so much more, especially in the context of young people and school.
When I think of mental health is if you have a pain, just a physical pain, you go to a doctor, right? And you say, hey, this hurts. But if you have an inside pain, whether it's sadness, anxiety, worry, then you go to a mental health therapist and you express that inside hurt.
I would say that it's a state of being where there's stability and clarity of mind.
Mental health is really the state of one's well-being. So for the case of children in the context of schools, mental health is their ability to feel well and function in their daily lives. And in the context of schools, that really means that they're ready and able to learn.
For a lot of people, you get the typical answer. If you're crazy, you have a mental health issue. That's not the case. Anything your mind is doing is your mental health. So from a kid's standpoint, it's how you deal with things. And it's just something as simple as that.
It's a huge issue that nobody really wants to talk about. Really is, I think, one of the most preeminent issues that we have to address.
Good evening, everybody, and welcome to an extremely important hour in which we hope to enlighten you about a problem that for a long time has not been talked about, and present to you solutions to that problem that you very likely don't know about, all concerning the mental health of our young people. On the outside, young people today appear happy, vibrant, full of life. The reality, though, is on the inside, it's a dramatically different story. So how are they really feeling? We actually have a great tool to gain insight into that. It's an anonymous survey called the YRBS.
The Youth Risk Behavior Surveillance System is an anonymous student-answered questionnaire that we typically give to students in grades 9 through 12, but in our district we also expand that to 6th through 8th grade. So we get a variety of information from our students that is self-reported on their behaviors, most often the risky behaviors. So tobacco use, alcohol and other drugs, sexual behaviors, physical activity, nutritional behaviors, as well as what is most important to us right now, suicide and depression statistics. And that's kind of our hot topic of where everyone's looking right now.
And so one of the great things about the Youth Risk Behavior Survey is we collect this data every 2 years, and we've been collecting the data since 2009. So we have 10 years of data on how youth in Duval County are doing in terms of their health risk behaviors.
So we have seen dramatic increases over the past few years in some of the behaviors that we would not want to see increases in, such as students reporting that they've been depressed for more than 2 weeks, or that they have thought about committing suicide or actually attempted suicide. So that's a concern for us. And 2017 to our 2019 data, we have risen in all of those areas.
We have about 40% of our high school students saying that they are depressed. That is a number that's increasing over time. We have about 1 in 5 students who are saying that they have made a serious plan to commit suicide, and 1 in 5 that are saying that they have attempted suicide. And so those numbers should be alarming to anyone that hears them. I think the other thing that the Youth Risk Behavior Survey tells us is that even though those numbers are really high, there are some populations in Duval County, in our high schools, that are at even higher risk for depression and suicidality. And those are our female students, Hispanic students, and those that identify as lesbian, gay, or bisexual.
What's particularly alarming about the suicide statistics is that the numbers in Duval County for those who have attempted suicide are about 3 times higher than the numbers for the rest of the state. That, of course, needs to be urgently addressed. But there are also many other ways that young people are showing outward expressions of mental health issues.
A lot of what we see is students not knowing how to handle their anger. life is going to bring you obstacles, but they're not sure how to get through those obstacles in a healthy way.
I think the number one thing that kids are facing is trauma. And what I mean by that is trauma as it exists within the community, so maybe community violence. It could be trauma for a death of a loved one, trauma for divorced family members, or loss of a girlfriend or a boyfriend. So our kids are facing traumatic experiences and they just don't know how to deal with them.
A lot of the kids are coming in, especially Mondays, in crisis. We're seeing them come off the weekend and unfortunately experiencing lots of things that they're seeing either in their own family or in the community. There's a lot of substance abuse, some domestic violence. Some of our kids have even experienced family members being killed. And they have to come in Monday morning and sit in a classroom and try and learn.
When you start layering things like poverty, for example, which is really rampant in a lot of our urban core areas, it just exacerbates a lot of core issues that are there. And with kids, and really at times with adults, just not having the tools to be equipped to address it.
About 18% of our high school students are saying that they're experiencing bullying on school campuses. We also have a high percentage of students that are saying they're missing school, skipping school because they don't feel safe while they're there.
I'm also seeing a lot more anxiety in kids, younger kids. We've always seen it a lot in high school kids, middle school kids, but now we're seeing a lot of anxiety in younger children.
Importantly, these struggles that young people are experiencing are not limited to specific, smaller demographics. These experts agree. Mental health crosses all boundaries.
Mental health issues not particular to any one demographic. It's universal across all students, all socioeconomic backgrounds, all grades, in fact. We're seeing younger and younger students. Mental health issues affect everyone.
And just like you have a physical illness like, high blood pressure or diabetes, you have to get treated for that, right? Well, when you have a mental illness, it's a brain disease, and you have to get treated for that as well.
And the problems are different and likely more serious than the struggles many of us have had in the past.
I think there is certainly the social media component and some of the pressures and some of the anxiety that we see with kids are far greater today than they were years ago.
Peer pressure of being on social media or being bullied through social media, those kinds of things in the past, even if I was bullied at school, when I got home, that ended. Today, it is 24/7.
Before, whenever we were younger, if we messed up or we got a bad grade or we came to school and, looked crazy for a day with what we had on, that was something that we dealt with ourselves. Nowadays, it's posted on Twitter, it's on Snapchat. Kids are making fun of you through all of their social media applications, and so there's no way that some of these kids can get away from it.
So we've shown you the alarming data that signifies why this conversation is so important. But now we want to show you that we are indeed making progress, sometimes significant progress. Great strides have been made, especially right here in Duval County, towards helping young people achieve better mental health. You've heard a few people mention one of the biggest reasons we've made that progress, overcoming the stigma of even talking about mental health.
Students are more willing to speak about mental health. The community is more willing to speak about mental health. Organizations are supporting mental health. So there's more of an awareness now.
It is absolutely vital that we normalize this conversation. I think one way that we can normalize it is to make sure that we're all speaking the same language, where students can have the conversation in their school and tell someone, hey, I'm struggling with a mental health concern, and they're not taunted. It's saying that, okay, me too. I'm struggling with that as well. So we develop this level of empathy within each other and create this culture, not only at the top, but in our school buildings, so students can know it's okay to talk about it.
And once it's okay to talk about it, the system needs to be in place to provide young people with professionals to talk to. That is where the greatest strides have been made here in Jacksonville, all part of an initiative called Full Service Schools.
Full Service Schools has been serving in the Jacksonville community since 1996. It started as a collaboration between the Jacksonville Children's Commission, which is now Kids Hope Alliance, Duval County Public Schools, and United Way of Northeast Florida. Initially, when this initiative came along, it only serviced 87 of our 160 comprehensive schools.
Those services, which included mental health counselors, operated out of regional school hubs. Students would then come to those hubs to receive services.
One of the things that we noticed, students had to travel from their home school to the hub in order to receive services, and that wasn't always practical.
Referrals were being made and kids weren't following up on the referrals. And what we've all come to understand, it's not that parents don't care about the kids getting referrals. They're working, they can't leave all the time to get those connectivities. And so the number of referrals that were being followed on were very low.
So in 2016, dramatic change came to the full-service model. The new idea was sparked when mental health advocate Jeff Chartrand was introduced to a new concept out in San Francisco.
One of the things that really impressed me at Thurgood Marshall High School in San Francisco, which is where I was exposed to school-based mental health, was that every single teacher, janitor, food staff person received trauma-informed instruction. So what that means essentially is this shift through, if Jeff is throwing a chair in the classroom, we shift from what's wrong with Jeff to what happened to Jeff. And just that shift in a different question opens up the heart of compassion.
And with that new lens in view, a new pilot model for Jacksonville was formed.
The Chartrand family, along with some other partners, said, let's think about how we can help improve access to mental health, and what would it take to have mental health therapists in each of the schools instead of having to go to one spot.
It started with a great collaboration with United Way, with the city of Jacksonville, with all of our critical partners who had been involved in this, to really begin to dream about what this could look like. What would that look like if we were able to deploy a licensed mental health therapist in all of the schools? And that's really kind of where our conversation began to go.
Through the generosity of the Chartrand Family Foundation, we had the University of Maryland come in and meet with us and our community partners and really study different models that were working.
The Chartrands showed up at our national conference. Jeff Chartrand actually came to the conference with some colleagues from Jacksonville, and they reached out and said they'd like to meet with us because they had a vision for what they wanted to happen here in Jacksonville.
So University of Maryland was a huge player in this, because one of the things I felt was important was to bring in national experts to, one, do a local scan of our existing system of care, and then point to other cities. They have that kind of credibility to see how folks have transitioned from what was a community-based mental health care system to a school-based.
We were invited to come down and to meet with partners who were already doing good work. And then we drove around to schools all over the county and met with principals and met with students and families and frontline educators to talk with them about what was already happening in the schools, what was going well in terms of student mental health, but also kind of what were some of the areas of need.
They were ready to go. They've done this in other school systems, and they were all set to do it here. And we were really excited when the community got so involved.
So what was birthed, I think, was a new system of care. And I think it's one that works better for kids and parents and all the adults in the school building.
The PLUS model actually puts a mental health professional within the school, so students and their families don't have to travel to a hub in order to receive services.
Initially, the pilot was 12 schools, so we were asked to work in the Ribault feeder pattern and work in the 12 schools in that area. So with the funding that was available, we knew that couldn't cover the cost of 12 therapists. So we proposed, knowing that those schools were Title I schools where most of the kids have Medicaid insurance coverage, we said when Medicaid is available, we can bill Medicaid. And this way we can bring 4 additional therapists to the table. And we can supplement and basically fill all 12 schools and have therapists in each one and be able to cover the cost.
And what we've seen is that that mental health professional actually becomes part of the school. They're seen as just another faculty member. Teachers are more likely to refer because they know the individual that they're referring. And parents get to know that person as like a school counselor.
The amount of referrals that we're getting has increased every year. Is an influx. We have a lot of kids that continuously come back for even more services that we offer. So it's a need in the community, and people are really using it.
When we looked at the data at year 3 on the number of referrals made, the number of kids that actually were able to follow through and got the services that they needed, truancy was reduced, behavioral incidents were reduced, grades were improved. It was like this epiphany for a lot of us.
So the New Plus model was clearly a success here in Jacksonville. Ironically, it then expanded because of a tragedy in South Florida, the Parkland shootings.
The timing of that happened, thank goodness. The governor and the state said, we need to deploy resources to do 2 things. We need to make sure we provide, it was $100 million. Approximately half of that went to making sure our schools were more secure, and then the other half of that was to go to mental health for kids.
The group then moved to bring everyone together here in Jacksonville and work within the political structure to maximize funding for this new program.
But we took this information and took it to City Council and to the Mayor's office and said, look, right now the city is funding $1.7 million for mental health. We believe that if we could get the city to match that amount, take it up to 3.4, along with what we were going to get through the state, through the grant with the state into the school system, and then to work with United Way, we could really be on our way to that dream of getting a licensed mental health therapist in all the schools. And today, I'm proud of the fact that the city answered the call.
It really is, amazing that from, one little pilot program, we were able to cover the whole geography of Jacksonville.
Now we're in all 160 Duval County public schools, providing access to over 128,000 students, where we're only providing 57,000 prior to the past 2 years.
We have a licensed mental health therapist assigned to every single school in Duval County. We're not quite one-to-one, but most schools that are in high need areas or have documented high referral cases do have their dedicated licensed mental health therapist. And some schools do share, but the results have been phenomenal. And we think we're the only place in the state that has this kind of model.
So what exactly does this full service model look like in action? We'll take a closer look when we continue with Igniting the Future, Victories in Mental Health.
Today may be tough, and tomorrow may feel uncertain, but we are moving forward together. This is our home. We're heroes, survivors, hard workers, and we look out for each other. And as we look to the future, News 4 Jax is right here with you every day, lighting the way with detailed reporting you need to protect your family. News 4 Jax on Channel 4, moving forward together, the local station.
When a friend tells you they settled their injury claim for $50,000, you might think that was good. But what if another law firm wouldn't have taken less than $500,000? If someone sold a brand new Mercedes for $10,000, you'd know they got ripped off. Many people injured in accidents get ripped off every day by the insurance company and their own lawyer. Visit forthepeople.com to see our verdicts against the last offer that was made. Huge differences. There are many firms, but only one Morgan & Morgan, for the people.
I bet some people watch these ads and say, that could never happen to me. I don't smoke that much, so I'm not really a smoker. Well, I didn't think I smoked that much either, but I still got oral cancer, and it came back twice. Now I have no jaw and no teeth. My tip is, if you smoke, you're a smoker, just like I was.
Quit your way. Visit tobaccofreeflorida.com.
Each week, Channel 4 recognizes the ViStar All-Star Athlete. If you'd like to nominate a high school athlete who excels in the classroom and in the community, go to news4jax.com and look for All-Star Athlete under the Sports tab. Staying informed is more important than ever. When news breaks, find out fast. Get breaking news alerts sent directly to you. Important updates from the people you know and trust. Subscribe today, only on news4jax.com.
2020, it is our time to rise. Each of you are destined for something so much greater than what we can see right now.
It's time to apply the lessons we've learned over these past 4 years and become the revolutionaries we were taught to be.
No matter what we are faced with, we will always overcome. Sometimes life takes you on a journey and it isn't what you pictured. We are truly going out with a bang, and our class will always be remembered. Pick yourself up, dust it off, and keep going. Nothing in this world can stop you.
Brightest and best on Channel 4.
Get this information to help get these children connected to resources.
There's one other part of the new full-service model that has proven to be an extraordinary success. Like with the model first seen by Jeff Chartrand in San Francisco, Duval County has implemented an extensive training program to fully get teachers, administrators, and all other school personnel on board with this new mental health initiative.
We are in the process of training all of our teachers in what is called mental health first aid. It's helping teachers to recognize those behaviors or signals that may indicate that a student is having difficulty.
And in that training, they learn how to assess for risk of suicide and harm. They learn how to listen non-judgmentally for those who may be impacted by a mental health condition. They learn how to give reassurance and information to those that may be struggling. And they also learn how to encourage self-help and other support strategies, as well as how that person can access resources.
So how do the teachers respond to this new way of thinking?
Well, at the beginning, it's usually, I have to be here, there's another training. But at the end of the day, they are so joyous and glad they came, and the reviews we get on our assessments are just amazing.
This training is hugely, hugely important because a lot of times, we personally get involved and our attitudes cloud our judgment about a student when really we should look at their challenges more so and take ourselves out of the equation as the teacher and just be more so a human being to these students who are dealing with a lot more issues than we get to see in an hour and 30-minute time span.
I think it really changes the way that we all approach our students and how we see them. And it's really important because we are developing the entire child. And we need to make sure that we're not just giving them the academic piece, but we're also making sure that they are healthy as individuals in their mental state as well.
One of the things that I hadn't thought about before today is how young some of the issues happen with some of the children. I had no idea that children 6, 7, 8 years old was going through some of these issues who I thought routinely it was an issue with someone maybe 7th, 8th, and in senior high school.
How does the full-service School Plus model serve these younger students in a real life setting?
Good morning. St. Clair Evans Elementary School is one of my favorite schools to visit because of the energy and passion that you see at that school. When I think of St. Clair Evans, I think of this oasis in the middle of a very unstable community that has to deal with violence and drugs and other things that are happening in that community. Yet when they are at St. Clair Evans, they feel protected, they feel engaged, they feel loved, they feel that their needs are being met.
The architect of that environment is its dynamic principal, LaWanda Polydor.
Everybody is happy, right? Yeah.
What she has helped this school accomplish over the past few years is nothing short of remarkable, despite its huge obstacles.
Thank you for looking this way.
Not very often do you drive to your job and see people talking to themselves on the street. I see that quite often. And then you have to remember these adults are having children and they are entering the school and they need to be taking care of, first of all, the whole child before you can even address any education that you want to provide for them.
But I want to say welcome to school.
And that's where she says being a full-service plus school is key.
So there are several programs that Duval County has provided me with in this school. One of them is my full-service therapist, which is housed here full-time, and so she's able to address issues from the first time they walk into the building, and if they sign up for her services, she's able to service them right on campus.
Rachel Powelson is the St. Clair Evans therapist. She says being on site makes all the difference.
Some of the kids that I work with here would not have access to mental health if I wasn't here in the school.
Luckily, I am here full time because the parents are like, oh, well, I didn't have time to get off my job, to take them to an appointment, to have them go see someone else. And then if I do, then I'm gonna get in trouble for missing work, or I can't pay this bill or that bill. Nope, if you send them to school, they're gonna get therapy.
Tyquez is one of Rachel's clients at St. Clair Evans. He suffered a brain infection a few years ago that made him have to relearn his motor skills. And during that process, he began to struggle emotionally, especially at school.
He started having behavior problems, getting in a lot of trouble, well, to the point where I couldn't hardly work like I wanted to because I was always getting a call. I had to get him some help because I was in the process of losing my job.
She gives them specific strategies on how to calm themselves down when they get in a situation where they're really stressed. And he's been able to use those. And he has grown over the past few years to such a wonderful young man who is doing a great job learning.
Amazing. He started getting therapy, and ever since, I haven't had a problem with him. Like, I appreciate her so much. She rocks. She's the best.
So with the advantage of having a therapist like Rachel on campus, plus other programs like Calm Classrooms, which we'll tell you more about in just a bit, this school has been transformed in many ways.
We've gone from a few years ago having over 700 behavior referrals to now we're right above 200 for the year. It has been incredible.
This is my 4th year here at this school, so I've been able to see a reduction in physical fights. I've been able to see more attention actually focused in class.
1, 2, 3, eyes on me.
1, 2, eyes on you.
I've been able to see kids actually ask for my help in mediating the fight. To have kids actually say, okay, I'm having an argument with somebody, but I don't know how to say something. Can you help me tell them? It's like, what?
We have grown. We went from a D to a B last year, and that was because of everything just clicking together. Like, it really took a village. So our therapist is a part of our village. Our parents are part of that village. And I like to try to lead the village down the right path towards excellent learning.
If St. Clair Evans can do it, all of our schools can do it.
So here is something interesting about full-service therapists that most people don't know. Despite working full-time with the school district, they're actually employed by several area mental health agencies. Children's Home Society was the first in the Ribault feeder pattern. But as the program grew, new partners were brought in to service other areas, from Child Guidance Center, Family Foundations, Jewish Family and Community Services, and Daniel Memorial. That's where longtime therapist Don Morgan comes from. Unlike Rachel, who works exclusively at St. Clair Evans, Don oversees multiple schools at the beaches, including here at Jacks Beach Elementary. But despite not being here full-time, he is fully embedded in all of the mental health efforts at the school.
He is lovely, first and foremost. He does small group therapy sessions and counseling sessions with our students. He is able to help us if we do need to de-escalate students. He helps us brainstorm strategies to use in the classroom when students are here with us on campus.
And of course, he is always available to work with students one-on-one. Students like Max.
Max has had trouble with his temper from the day he was born. In preschool and kindergarten, first grade, we definitely struggled with transitions for him, peer interactions.
When I first met Max, really intelligent young man. Max was struggling on an emotional level. He had a very hard time controlling his anger. He would get very upset verbally and sometimes physically. Academically, he struggled not because of his intelligence, but because his behaviors were just getting out of hand.
And I started yelling at Henry about it.
Okay, so you got frustrated, and instead of calming down, you let that frustration come out.
Yeah.
We started building up strategies for him, giving him that language that he needed, helping understand coping skills and how to recognize that he was getting angry and how his body was reacting to that.
I shouldn't have gotten super worked up over nothing.
And when he learned to then understand what his body was telling him, then we could move on to the next step of him using coping skills.
How'd you bring yourself back down, Max?
My mom sent me to my room, and I started reading my book, and that kind of calmed me down.
Having him meet with him one-on-one and with groups, it has given him all kinds of language that he didn't have before. Dawn and I work together so we can use this language at home as well and with his teachers. A lot of talk of going from, green to red and where's yellow and all these great terms that have really helped him identify his feelings, think of other options. So having these words and these terms really work for him.
Not only did he start buying in, but his social skills started to improve. He started to participate more in school on a really high social level and starting to interact well.
3rd grade has been magic for him. He has really taken all of those skills, internalized them, and is using them. He now has all A's, and he has a B in behavior, which for us is the best he's ever had. He's really thriving.
I have seen a significant improvement in his behavior. I have seen him a lot less for negative things and much more for positive celebrations.
I don't think this would be as effective sending him to a counselor outside of school. That would be such a hindsight sort of approach. Dawn has showed up on days when something was happening right then, and he could come in and say, I'm here, let's talk about this. Let's go right now to a spot and process, and that's huge.
It was a process. And that process is still ongoing, but he's gotten to a good place in that process. I think a lot of people kind of look for that miracle behavioral cure, like, we're gonna give you therapy and all of a sudden you're gonna be fantastic. But Max is a great example of the work that was involved and the partnership that was involved with the school, and being able to have teachers that were open to trying strategies, and having Mom do an amazing job educating herself and using the strategies at home. That ability for her to then come in and partner and be empowered herself has dramatically helped in that case.
I'm so proud of him. There was so many days when I really worried that we weren't going to find the right match for him, and that I was worried he wouldn't like school. And he's such a smart kid, and he really loves challenges. So for me, him liking school is really important. I really think Max is going to do great things, but obviously you have to get through school and you have to, conquer that. So for him to do well in school and really love school and love his teachers is amazing.
During the Rooms to Go Memorial Day sale, change how you sleep. Buy a king or queen mattress set and switch to an adjustable base for free. Choose Serta, Beauty Rest, Sealy, or Therapeutic sets and switch to an adjustable base for free. Right now at Rooms to Go.
Your industry markets cigarettes even though there's lots of scientific evidence they're harmful.
I disagree. I say the evidence is not conclusive.
The Surgeon General says smoking may cause everything from lung cancer to heart disease.
Well, in life you have to take some risks. Am I right?
Tobacco is no joke. It's so deadly they need you to replace dying customers. Learn more at thefactsnow.com.
Yard work is in full swing, and it's the perfect time to buy that new John Deere with Ag Pro's Load Up on Savings sales event. With low monthly payments, you can have the best looking lawn in town. We have lawn and garden tractors and zero-turn mowers starting at just $57 per month. Or get a compact tractor starting at $99 per month. Visit one of our 18 full-service locations in the Southeast for all your parts, service, and sales needs. Or find us online at agproco.com.
Right now, we're all having to adapt. So it's only right that at BMW, we adapt the way we support you. Which is why, if you need a vehicle, we're offering special financing options. Just choose the model that best suits you by shopping online. And for the safety of our customers, we're now providing service with at-home pickup and drop-off. Because in times like these, we need to do more than just adapt with each other. We need to adapt for each other. Get 0.9% financing plus a $2,500 credit and no payments for 90 days.
It's the Flooring America Shop at Home event. While our stores are under construction, Flooring America will bring the store to you. Let our flooring experts provide access to our extensive selection of the finest flooring available, right in the comfort of your home or office. Get a free estimate on hardwood, carpet, luxury vinyl, tile, laminate, and more. All still available at affordable prices with coupons available at flooringamerica.me. Save today with Flooring America's Shop at Home event going on now. New store locations opening soon.
It's the Rooms to Go Memorial Day sale. Relax and get comfortable in this reclining sectional for just $19.99 or $34 a month interest-free in your choice of colors. Plus, add the matching recliner for just $199. Shop and save during the Rooms to Go Memorial Day sale.
So we've shared a few stories from elementary schools. We turn our attention now to the front lines of what is happening with Duval County's older students. Phoebe Hernandez is a senior at Inglewood High School. She's an aspiring artist and quite talented. But to get where she is today has been a journey and a great example of how a young person can change the trajectory of their life with some help.
A couple of years ago, it was a very tough time. It has always been a very tough time. I was in a very dark place.
She was minus everything. She was, oh no, I cannot do this. I cannot go there. I'm never going to college. I'm never going to succeed. She was so terrified about the future. And I didn't know what's going on, and I didn't know how to handle. I think that is the first thing that as a parents make us be more worried about is we don't know.
Phoebe is such a unique student in that she is such an introspective, bright, talented, artistic young lady. She comes from a family where she has multiple siblings, a single parent, and she wants nothing more than to be successful in school and to go to college.
Puberty is difficult for everyone's, not just hers, it's for everyone's. We need someone with the skills and the knowledge to help us and guide us.
Phoebe was referred by her mom, and that is how referral came to me. And at first, it was a rough journey, because Phoebe felt uncomfortable at first, and it was kind of testing waters. Can I trust this person? And over time, she realized this is a safe space, and I can open up and with no judgment.
Whew. If she hadn't been here with me, I might not be here right now. She's made me realize that, it's all right to be vulnerable. She made me realize the size of my problems.
Luckily, she has been open to and been accepting of the help that is offered. Because I will say, one of the challenges we have is even when full-service therapists and full-service support are completely available, there are some times when students are not open to the help.
Just one step at a time, just baby steps.
It's a process. It's really a process. And it's all about finding yourself. Have you ever tried to find a shoe? You think you know where it is. You find it, turns out to be the other shoe you already found. And it's really different.
It's not linear, it's a roller coaster. There's ups and downs, but as long as we have this goal that we keep our focus on, and that's all that matters. And with the guidance, my guidance, her mom's guidance, teachers, she was able to get there.
You change. Not change, like become a different person. You grow like a plant. If you plant a plant, it's gonna be the same plant. It's just gonna have a little bit of differences. It's gonna be perhaps more color, perhaps less. You don't know really. But it's growing, right?
So with Amra by her side, Phoebe has begun to, like a flower, blossom. And for that, her mom will be eternally grateful. She gives the credit to Amra.
She is a lifesaver, for real. She cares, she worries, talk to her, walk with her, put on her shoes, which is important too, because we're not able to help her if we don't understand her.
When I first met Phoebe, she was really unsure about her ideas, not totally into what she was doing all the time. And now when she comes in, she brings a life and vibrancy to everything that she touches. She's interested in what she's doing. She knows why she's doing it. She has a plan for how this ties into her future artistic plans. Phoebe as an individual, I've seen a major change from last year to this year, and only good things have come of it.
You can tell that, her emotions, she puts her heart into it, and just you can see the transition from the day she started to now, how her art changed as well, from the sad emotions to more positive and vibrant. And I just get these chills just thinking just the beauty of the journey. It was not, like I said, it was not a clear journey. It was very rough. It was messy. By the end of the day, she just blossomed this beautiful flower, and it's just amazing to, see her grow into the student she is today. And she's graduating this year, so that's just beautiful and rewarding to see her get to this point.
I'm so proud of her, not because it's my daughter, but as a human, I'm so proud of her.
For many years, Douglas Anderson has been known as one of the top art schools in the U.S. But with that comes unique challenges.
Stress, anxiety, I think are the two main things that kids struggle with, especially here at a high-performing art school.
Well, leave it to the creative students at DA to develop a creative solution. Along with Miss Anderson, their sponsor, 3 years ago, the students took it upon themselves to create a unique service club. It's called DA for Change.
DA for Change is a club that sparks initiative in our students to become leaders and change agents in our schools and communities. And the focus is on promoting positive character development and mental health.
The group is made up of students like Armane Shakur. She was bullied in middle school because of her heritage. The club now offers her the chance to help stop others from being victimized by bullying.
In junior year, I figured, okay, I need to do something about this because I'm witnessing it at school and I shouldn't just sit here and watch it happen all in front of me and just not do anything about it. So my guidance counselor told me about DA for Change. I turned all of that anger and sadness of middle school into fuel to make a change in my environment. I want to make bullying not a thing at DA. I just want bullying to just go away.
So with many others with the same kind of passion as Armane, the club has quickly grown.
Anytime something is student-led, it's more successful.
I love that we have free range. It's fully student-led and student-run, so just the freedom to come up with projects and actually execute them and see the turnout, it's really eye-opening.
So what exactly are the kinds of projects the club takes on?
We started the school year off with Just Say Hello, and it's a week-long event where we encourage random acts of kindness. Also, no one eats alone, so we had our students go sit with other students who were sitting alone during lunchtime that week. So right now our current project is called Take What You Need.
Invite your friends over. There's envelopes that are labeled confidence, patience, kindness, love. And the idea is that students can walk by, and if they aren't feeling confident, they aren't feeling loved, then they can grab a slip on their way to lunch and they can read it and they can feel encouraged by the quote that's printed on there.
The district also reached out to us to develop a Wellness Wednesday lesson. So club members got together with some district representatives and created a lesson on how to talk to a friend who might be suffering.
My name is Mary, and I'm the president of DA for Change. Today we're going to practice mindful communication. This will help us show up for our friends and to be a good listener.
I had a lot of people come up to me and say that that video about if you're in a crisis and you need help, it really helped push them to get the help they needed or to reach out to a friend. Or I've had friends say I now have a better toolkit to help someone in need. And when we all do this, we help to create a safer and healthier school.
Everything happening here is actually the culmination of a dream for Kathy Anderson. She's wanted to see a student-led club like this at DA for years. Her passion has been contagious.
And then say something to a trusted adult.
She's amazing. She helps me a lot. Even though I'm a teenager and some people just say that I don't have a voice, that I shouldn't be doing this, she really makes me feel like I have a voice.
Oh my goodness. Miss Anderson does not get enough credit for DA for Change. She really cares about mental health awareness and the students, and I don't know, she's just so sweet.
Bottom line, DA for Change has produced change.
I've seen kids be more friendly to each other. I've seen kids just make new friends, and I felt really, I'm proud of myself that I did all of this to help kids.
The impact has been more than I could have ever have hoped for.
I think this club's destined to do great things. I think the club is already changing the culture at DA. I think it's becoming a really open forum between the adults and the students, and I'd like to just see it keep growing from there.
So we've explored a number of uplifting success stories from the mental health initiative here in Jacksonville, mainly tied into full-service schools. But here is something we haven't talked about specifically. How exactly are we working to help young people avoid mental health issues? Let's dive into that.
Looks like we're ready to go. Let's get started.
There are two main programs that lead the prevention efforts. The first, Wellness Wednesdays.
Wellness Wednesday is a new initiative that our county put into place this school year. It is the early dismissal Wednesday every month.
Every student in every classroom across the district on the same day is receiving a message about mental health or de-stressing techniques, calming techniques, breathing techniques, who to go to if you do need help or if you have a friend that needs help, and they're being made aware of those resources.
So Mental Health Wednesday was passed this last year by state board rule for just grades 6 through 12. Our district has taken it a step further. We are implementing it in K through 12.
Of the ingredients that we put into our recipe for friendship.
30-minute lessons that are fully scripted, videoed, they're paced for teachers, so literally it's a play.
There's fun videos always within. Kids look forward to getting to watch those. There's ones about like people are different and the same, and we all have different emotions, but we can all get along if we just try to look past it.
One of the big topics is bullying, because we know that that's going on for so many children in our country, and it's such an important and frightening topic.
The cyberbullying and all the internet safety issues that are really imperative right now for us to make sure that we address with our students, what it means to be safe online and not talk to strangers, or how to be a good digital citizen.
Today, we will learn how to be a good digital citizen. No matter where you live or what you do online, we are all part of a digital community.
The second program is an extremely innovative idea we mentioned earlier, called Calm Classrooms.
Calm Classroom is a mindful meditation program. It takes about 3 to 5 minutes to implement. What we encourage our schools to do is to utilize Calm Classroom at least 3 times a day.
Calm Classroom has really been a blessing for our school. I was looking for something to support our students in really being able to transition those emotions when they're upset, when they're angry, when they're very hyped up from something, and we've got to get back to focusing on the academics.
Initially, it was rolled out as an enhancer to student productivity. But we found out after implementing the program that it transitions and translates into all other aspects of life. We've noticed that the kids are able to manage their anger better. They're able to control their emotions.
Feel your feet flat on the floor.
Breathe in through your nose and lift your elbows up.
We've done one that's called like energy hands, and it's pretty much where you move your hands and then you get to feel the energy between them. So like it's where you rub your hands together and then you take them apart and you can feel the energy in between your hands.
I love the scribble. There's a drawing scribble one, and when your eyes are closed, it's based on music.
Keep your attention focused on the sound of the music.
So the music and the type of music changes. But by the time you're done, it's really cool to see the creation that you've made.
Student reaction is they actually love it. They love it. The teachers love it. The kids love it. They ask for it.
I felt calm, relaxed, and I was floating inside of a winter wonderland.
We have had nothing but a positive result. I've even had a few students mention to me that they've taught it to their families and they go home and try to emulate that.
When you do that, I feel like kids are more kind to each other, and that's something that I feel like we should have more of, kindness.
By the way, one interesting side note, we actually now have scientific evidence about Calm Classrooms, thanks to Mr. Vasilev and his 3rd grade class, who took on testing the concept as a science project.
is what we want to do is test the student's heart rate before and after doing the Calm Classroom. And we noticed that on average, the student's heart rate went down 5 beats per minute after implementing the Calm Classroom, which was really cool to see that there was actually scientific evidence built into the Calm Classroom.
As you've seen, the successes in mental health here in Northeast Florida have been significant. But what still needs to be done? We'll explore when we continue with Igniting the Future, Victories in Mental Health.
With zero interest and zero payments for 90 days, you have zero excuses to not have your new Hyundai by Memorial Day. Now, get 0% APR financing for 60 months or up to $2,000 cash back on the Sonata. Visit buyhyundai.com today.
Falling wasn't my fault, but I lost control of my life.
I needed medical attention.
And the bills were piling up.
So I took back control.
Our family took back control.
I did too.
By calling Anajar and Levine.
I'm Ellie Anajar from the law offices of Anajar and Levine. If you've been involved in a slip and fall accident and are not sure of your options, call us at 904-600-4000 for a consultation and take back control of your life.
Your local Ace remains open, and while you could still come in or pick up curbside, we'll also deliver to your home. So if you need essentials like hand soap or light bulbs, we want to help. If you need quick fixes or filters, we want to help. But we couldn't help without the people who put on red vests every day and say, we want to help. The helpful hardware folks. Ace couldn't help without their help. So to each and every one of them, we say, thank you.
Ace is the place with the helpful hardware folks.
There are moments in our lives that make us realize how fortunate we really are. To breathe fresh air, to taste the salt of the sea, to be able to roam free in nature. The Florida Keys and Key West will soon be open to visitors. Visit flakeys.com for details. We have so much to be grateful for.
With zero interest and zero payments for 90 days, you have zero excuses to not have your new Hyundai by Memorial Day. Now get 0% APR financing for 84 months or up to $3,750 cash back on the Tucson. Visit buyhyundai.com today.
When tomorrow feels uncertain, trust in your local news team is more important than ever. And its relentless dedication earning News4 Jax 4 prestigious Edward R. Murrow Awards, including Overall Station Excellence and News4Jax.com Best Website. And closer to home, Florida broadcasters honoring News4 Jax with 10 first-place awards, including Station of the Year and Best Website. News4 Jax on Channel 4, the local station.
So it's pretty clear to see that what has been built here in Jacksonville towards guarding the mental health of our young people is really among the best practices in the country. But what else is still to be done?
This is too urgent of an issue to reinvent the wheel. And so what we need to do is look to other communities that are dealing with similar issues and have had successes. So what other communities have dealt with high levels of depression, suicidality among their youth? Have they seen reductions? And then if so, making those connections to find out how they created that change.
We just want to make it better for other people out there that don't really know where to go. We've been interviewing, again, the different nonprofits in the area and trying to figure out where is that next step. I mean, how do we bring either people together again to help navigate the system?
We still have a lot of work to do, again, trying to remove that stigma from asking for help, needing support, whether it's a mental health therapist or a guidance counselor or whatever the resources are available and needed, is continuing to get that message out, because I still hear people say, I didn't know that was available.
So this model is getting better and better all the time, and we're continuing to refine it, and that's one of the great reasons for this partnership, is that we can keep building on it. And we're really grateful to the city, to Kids Hope Alliance, to the school district for working together. It's been really, I think, something that Jacksonville should be proud of, the way we've come together. We couldn't offer this service to our students without our partners. We are not the experts in mental health. We have mental health experts in our community, and through the partnerships with United Way, Kids Hope Alliance, and all the many mental health serving agencies that we have agreements with, we couldn't do it without them.
So there are a lot of future directions for mental health in schools across the nation, and my guess is this community will be a driver of some of that because they're already so far ahead.
Breathe out. Lower your elbows down.
We're going to expand Calm Classroom in a few extra schools so they can have that Tier 1 availability within our school district. Another thing that we're looking at is training our middle school teachers next school year. That's on the horizons. This year was high school. Next year our focus will be on middle school.
All the things that we had kind of hoped and dreamed that were possible, we've been seeing now that are really happening now. This may be one of the strongest moves that our city has made and will make in the investment of our young kids, to be able to help them understand early on how to address some of these real critical issues that they're facing. I couldn't be more excited about it, to say the least. And so, it's just incredible for what all of our wonderful partners. It's why I love this city. When our city comes together, we can accomplish anything, and this is a great example of a major step.
And this major step will pay dividends for many years to come for our young people. Interestingly, with the COVID-19 pandemic that arose over the past couple of months, mental health has become an even more important issue for school-aged kids. Experts are saying that when children return to classrooms, there will be an even bigger need for mental health services within schools. While many places will be ill-equipped to face that demand, Duval County will be able to rise to the challenge for the reasons you have just seen. We hope you've enjoyed watching.